What's going on, nurses? How y'all doing? Today, sorry, I have to kind of keep my voice low. People are asleep, so today I really wanted to talk about your longest day in nursing. So the reason why I want to talk about this is because it hit me, or it dawned on me, that when I became a cardiac surgery ICU nurse was when I was really a nurse. And all the sciences and everything that you learned in the past are starting to come together, and you're starting to see a bigger picture of the patient rather than the inpatient, and they're stable and you're just trying to discharge them. So your longest day in nursing is the day that you realize why you are in nursing. And I talk about this not so lightly, but pretty heavily because uh, when that let me tell you, okay, what happened to me and how it dawned upon me was when I think I was like 4 weeks into my internship as a cardiac surgery ICU nurse. Like I was taking report, doing my doing everything that was necessarily possible, and I realized that I don't know nothing after all the reviewing, and I was there, going through the motion, and a lot of the pieces of the picture weren't coming together for me. And I realized that, it's a lot more to do outside of the hospital rather than in the hospital. And you have to be a nurse. And what I mean by that is you're continuing to educate yourself, you're continuing to learn, and you're continuing to put all these pieces and concepts together. And that's what's going to make you a better nurse is specifically that. But that the longest day in nursing for me was when I realized that this patient was on ECMO, when this patient was on a BiVAD, left and right, when this patient also was on heart, tandem heart. So for those who don't know what those are, long story short, it's a lot of right-sided heart support. And this patient was already in renal failure, and they were deciding whether or not to start this patient on a CRRT. And when you think about it, the patient's BUN and creatinine were just out of this world, and that's something that you had to think about. Instead of chasing the urine output with Bumex or Diarrhea, you realize that there has to be something done. And that's that was my longest night. And taking a look back at it, like I still am blown away by the things I've learned in these past how many months. But yeah, for me that was the longest day in nursing. And thank you for listening. Like I told you, I'm gonna start doing vlogs like this rather than having to edit. And this is just for me to vent. And I know that there's a lot of people out there who want to become nurses. So my advice is take a look at yourself and whether or not you want to help people, if you're a people's person, because if you don't love people genuinely and you yourself cannot take care of people and can't handle poo well, this might not be the field for you. All right, hope y'all take care, and I'll see you guys in the next video I produce.